feel like in oncology nursing you can really make a difference in somebody's lives, not only with the patient but with the family as well.
When patients are in the hospital, I try to just give them a smiling, friendly face and just brighten their day just a little bit.
I enjoy seeing the patients progress from beginning to end and seeing how I can make a difference on making them live a healthier life.
Build up their confidence, teach them so that they can be the best mom they can possibly be, and to take care of their babies.
My impact to healthcare is my ability to show compassion to my patients, and usually when they're in the emergency departments, generally the worst time of their lives. So my ability to reach out and make them feel comfortable and at ease, and then also my ability to get them to laugh and have a sense of humor and be able to lighten up so we can get the ball rolling from there.
I provide the direct patient care. I'm the one that pushes the patient to make them better. I'm the one that in 2 to 3 years they're going to be like, it was Rebecca who got me out of that bed. It was Rebecca who pushed me to walk and got me where I am today.
We're big on family-centered care, so making the patients and families feel comfortable. We get a lot of really sick patients here at UC, and it's really important that they feel that they're in good hands.
I enjoy being a navigator for the patient and helping the patient coordinate their care and treatment through survivorship.
Making them feel better however I can, whether it's helping them with their medical needs or personal needs, or just being someone there for them to talk to.
Picturing yourself in the patient's shoes and imagining what it would be like, and then you can really advocate those needs and collaborate with the team.
My patients, I'd like to be a big impact on not only their health, but their spiritual health as well.
My impact to healthcare is to positively impact the patient's experience.
The most important thing is I want people to know I care, because I think people really don't care what you know until they know that you care about them. And if you care about them, then I think it helps break down walls.
I try to make my patients feel at home and help them not feel like they're in a hospital setting.
Sometimes when patients don't feel well, I think that they need somebody to just to show that they care. Give a helping hand, a warm hug, or a couple of nice words.
We tend to focus on family-centered care, so not only teaching our patients, but also the family.
Well, what I like most about nursing is being able to be present to people during difficult periods in their life, trying to connect with them on a spiritual, physical, and psychological, having some impact there.
My impact to healthcare is to always make sure that the patient is always involved in their care.
I would say my impact is treating families like I would want my own to be treated. Having been on the other side and recently being diagnosed with cancer, and seeing how people treat, the healthcare industry treats people, makes you want to go that one step further and let people know that we do understand and we do care, and that every family is different and everyone is important.
My impact to healthcare is to educate the patients so they understand their procedures. We want our patients to feel comfortable and decrease their anxiety.
No one wants to be in the hospital, so my goal is to make their day as happy as possible.
I try to just stay positive and try to keep my coworkers positive, try to keep my patients positive about everything that's going on.
My impact at healthcare is probably looking at the whole patient and not just what brought them into the hospital. I like to know everything that I can about that specific patient, so that you can catch little details and minor changes to make sure that their stay here is safe and that they don't come in and have more things wrong than when they leave.
I am the liaison between the doctor and the patient and the educational piece to link them with their medications, appointments, follow up, and to make sure that they stay healthy.
I take care of the littlest of the littlest. I have some that are the size of pop cans that fit in the palm of my hand. My goal for them is to raise them up and to be assets to society. So what I do today impacts my future for tomorrow with my babies.
My impact to healthcare is to make the transition from home to the hospital stay as easy as possible, less stressful, and to make them comfortable as possible.
Addressing their, not only their physical needs through medicine, but also their social needs, comforting them through their stay here, and also being a friend to them.
I think my impact to healthcare is just making the patients' lives a little easier while they're here. Anything that I can do to make their stay just a little more pleasant, that's my goal.
It's really important to connect with them and make them know that they're important and that their healthcare is important and that I'm here for them no matter what.